Welcome, everyone, to today's episode of Dare to Age Well Now. My name is Angela Belford, and I'm your host, and I'm joined today by Dr. Mark Banasiak. And I'm super proud of myself already for getting the name right, hopefully. Dr. Mark, tell us a little bit about yourself.
Well, you get prompts for pronouncing my name. Which part would you like to know? I could talk about myself forever, but I have been in chiropractic, or I've been practicing chiropractic for 30 years in Southern California and Temecula, California, always with the idea of why is this person in front of me versus just adjusting them very rapidly. So, really kind of being a sleuth of what's going on with them. And then with that pursuit, what are some of the additional therapies above and beyond just manipulation of the spine that I can use to forward this person's health quotient? Not just take them out of pain, but what's going to actually make them better in the long run so we're not having the same conversation 20 years from now.
I love that. A health quotient. I love that idea because there's more to health than just a lack of pain. There's more to
Absolutely.
thriving. I think that's fantastic. So we talked about that one of the kind of treatments that you do and have seen a lot of interesting success with is around spinal decompression. And so why don't you start by telling us what would a client show up with symptoms that would lead you to think they might need some decompression therapy, and then we'll get into it about exactly what it is.
Symptom wise, patients will present with a plethora of different symptoms, maybe related, maybe coexisting, maybe not. Um, the typical when it comes to lumbar, spinal, your low back, decompression, back pain, disc radiculopathy, which is like a sciatic pain going down your legs, starting in your back, maybe not starting in your back, maybe starting in the buttoctal area. Spinal stenosis. Spinal stenosis is where the spinal cord or the nerves that exit the spinal column are being compressed, either due to bony compression, disc being bulged or herniated. So with that, somebody that might say, my doctor said I have an L5 disc issue or of L5 disc herniation or L5 disc bulge. And it doesn't have to be L5. It could be four or three. Four and
Yeah.
five are the most common though.
Okay. And so I'm
Also,
showing
I
up
should say with
and
that, I completely left out the neck. Similar things in the neck pain, radiating pain down into the shoulder blade or into the upper extremity all the way down to the finger. We also have cervical spinal decompression.
okay. And so we talk a lot on the podcast that people think of chiropractors and they think it's just for back pain. And so
Hmm.
we do a lot of myth busting on that's not the only reason. However, it is a primary reason people go to the chiropractor, it turns out.
Totally.
And I've heard some people that are like, "Ooh, I don't know about the manual manipulation or different things that people." So tell us a little bit about what decompression therapy is.
I'm going to explain a little bit of anatomy and how the body works. The discs of the spine, they need to be nourished. They need to have nutrient flow to them, just like any other tissue in your body, muscle, skin, bone, whatever. The discs, however, do not have a direct input of blood flow to the disc. There is very tiny capillaries that surround the disc at multiple levels or at all levels of the spine. And so what happens in a decompression therapy, the rationale for it is when we stretch the spine, we're going to lessen the pressure or decompress that disc and joint. And that by nature is going to create somewhat of a relative vacuum or a lower pressure. And as you know, fluid, water, blood, whatever, goes from a higher pressure area to a lower pressure. And so basically we can think of it as it draws that nutrient flow that's coming from the capillaries, the small blood vessels that nourish that area, and it's helping heal that by that continuous pumping because a decompression is not just somebody lying there on one continuous traction. It will pull very slightly, very slowly till it reaches a maximum weight, and then we have a program, and there's some experience that goes, or a lot of experience that goes with this, to where it pulls and pulls and releases, kind of like an accordion bellows. So we're getting flow to that joint in that disc.
So I imagine it that like some of the times when people have issue, this is something like pre-surgical. I've been might have been told I need surgery, so someone might, maybe they're not to that extreme. But the thing about your our spine is it's hard to do that physical therapy on those particular joints. Like I could go and they could do stuff with my elbow or my shoulder, but it sounds like this machine is actually doing those sort of exercises for us. Am I understanding it correctly?
Yeah, you could look at it that way. Decompression therapy, non-surgical decompression therapy, to be exactly correct, is a method in which it's practically really the only therapy that will allow a measurable, continuous improvement of nutrient flow to those discs. So under that, and I'm assuming that everybody knows this, but I should point out, discs are living tissue, and we already said they don't get nourished like very easily because they don't have direct blood flow. But it's very important that the spine moves in all ranges of motion to allow a disc to nourish itself. So typically, a person may or may not have pain, but they may have gone through a period where maybe they had an injury a long time ago, and it forced the spine to be in somewhat of a state of dysfunction, i.e., improper movement in all ranges of motion at one of the segments. Generally, the low back, sometimes the neck, almost never the mid back, just because of the architecture of the body. So if the bones are moving, here's what I tell patients: if everything was lining up, moving perfectly, it would allow the body to nourish itself appropriately. And if everything was getting nourished and had proper tension on it, we wouldn't be sitting here having a discussion. Somewhere along the line, the body stopped moving appropriately, whether it was something you did a long time ago or was something you did 6 months ago or whatever it was. So that improper movement prohibits the body from nourishing itself the way it should.
Okay. Sort of like and something that's just a little more visual that we see is like if my one knee is hurt and I favor that knee, then I end up putting a lot of extra pressure on the other leg and sometimes can hurt myself. In this same way, we probably are compensating for something. And sometimes it's a little mind blowing to try to think about it as like you may not even be in pain for this whole 20 years, and then suddenly your body just, it's been too long and too much, it's kind of accumulated, and now suddenly we are seeing the effects of this dysfunction, and your body may have been compensating fine for years. Is that correct?
That is exactly correct. The other phenomenon, and we all know this to be somewhat true. We think about it when you were a kid and when we were younger, you could fall. Oh my gosh, that hurts, and then 10 minutes later you're fine.
Kiss it, make it better.
With yeah, rub some dirt on it. With each passing year, our body loses some of its recuperative powers, and it takes us longer to heal and replace cells and replace tissue to as near normal as possible. And some people have repetitive traumas over the years or repetitive movement traumas over the years that just kind of stack on themselves. There is the idea, obviously, that the body heals itself, but not always the way we want it to or the most optimal way. So I tell patients that think about every issue. You were in this car accident, and think of it, you have to carry your books to school. I had to carry my books to school, and as a kid, that's why I'm bitter about this. So
Uphill both ways.
so one accident that you had when you were 19, that's a book. And then you did this repetitive 1.5 hour drive each way to work in gnarly traffic. That's another book. And, then you had a weightlifting injury or you fell on a bike or you were trying to rollerblade. You just keep adding these books and it becomes more and more untenable to carry them around. So ideally through whether it's decompression therapy or some of the other therapies we use, we're trying to remove those books so the body can not have so much abnormal stress on it. And the other thing I try to have people think of in an abstract or like a visual way is when we're younger, we have this big window of error. Like we can screw up, fall, whatever it may be. And the body has this big margin of error to where it won't really bother it. And each passing year, or with maybe some people have had surgeries or have hormonal conditions or sugar handling conditions, which impedes healing. That window of error gets smaller and smaller and smaller and smaller. It's almost like you really can't mess up. And on that idea there, doing proper nutrition, addressing issues with the spine, movement, stretches, what we think, how we eat, all these things, we can expand that window. We can at any
Mm,
age. And this has been shown that movement is one of the primary healers. There was a podcast, Mel Robbins had a guest on that. Basically, she was a neuroscientist, neurosurgeon. She said the very best thing people can do is just move.
mhm.
So we try to encourage that movement.
That's fantastic. And it seems so simple. And yet, when we are in pain, especially when our backs are bothering us, our neck is hurting, and that often neck pain can lead to either like our head's hurting or, like you were saying, tingly fingers, all of those, then it's like the thing that we need to do is to move. And the thing that our body says is, no, 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 if you move, you will hurt. And we have to sort of mentally push past that pain some of the time to be able to do the thing that we know we need to do. And it sounds like sometimes we have to have some help with that. Sometimes having a
Exactly.
chiropractor getting us in the right alignment or some additional therapies might be helpful.
And sometimes the signal of pain is the nervous system telling the body to just stop. But
Mm.
sometimes the pain signal is be careful, take it easy, do half, half, and half. What I mean by that is patients will say, can I work out when I have this injury? I said, yes, but half the weight, half the number of reps, half the amount of the time and intensity. So don't become completely immobile, but push toward, it's like you say, push through the pain, but push toward a goal of normal and optimal health, realizing that you're going to have some limitation.
I really wrestled with this a few years ago when I was learning to figure out how much I could ride my bike. And I had previously had just an old crappy bike. And after about 2 or 3 miles, my knees would hurt, my legs would hurt, and I would be like, I should stop. I have all this pain. And then my friend is like, well, you have a very heavy bike, so let's get you on a good bike. And then, so the right equipment was huge, huge part of that. And then what's so interesting is that I got into with some friends that we did this trail and it was 5 miles. And so had to. It was around a lake. I didn't have an option to only go 3 miles. I had to go 5 miles. And the craziest thing happened between mile 3 and 4 is when I really started feeling good. And it was like my muscles relaxed, that little bit of tightness that I was seeing. And I was just like, oh my goodness, I took that pain to mean I should stop. And that just means it's okay. And then I started riding on hills. And I finally would have to tell my brain, it's okay that your legs hurt a minute. You're gonna be okay. And I literally would have to talk myself all the way up the hill and go, it's okay that you're gonna hurt because you're gonna feel really great at the end of this ride. And I had to compel myself. And then I was shocked by mentally those things when I pushed myself physically, how then mentally I got stronger because then I was like, oh, okay, you can do hard things even physically. So I've had to get that nuance. Like I have to listen to my body when there's a pain of stretch and there's a pain of this is gonna break, and or this is gonna lead to injury, and you gotta really dial into your body on that. But I love the nuance of it. Is there any advice that you would give to patients as
Well,
they're on this journey?
and this is another bit of advice I do give is there is going to be a mental aspect to this, and uh, in the past, some doctors have talked about back pain and pain. It's all in your mind. It's you're depressed, and they even give people depression drugs for pain. And they show up at my office because they're fed up. They're not getting better. They just are all drugged up. There is a mental aspect to what happens to the body neurologically and physically when you have pain. So what I try to coach them to do is understand that I don't mean it like it's all in your mind, but there is a part of your healing that if you visualize movement, understanding pain is going to be a partner for a while, but one day it's going to get off the train and you're going to keep going. But understand that you it's almost like you're going on a trip somewhere. If you don't have a map and know where you're going, how are you going to get there? Well, the same thing with trying to heal an injury or having some sort of pain is you have to know what your goal is. And your goal is not just I'm out of pain. It's I can sit for 3 hours without my feet going to sleep, or I can go for an hour and a half riding the car without having to walk around like a little old man when I get out, or whatever the result may be, and visualizing in your mind that you will get there one day, provided you do all the things. It's like a recipe. You have all these ingredients sitting out in front of you on the counter, and it says things like turn the oven on, add this, add that. If you do the recipe and and when somebody's making a recipe, they don't go, I don't know if this is going to work. I don't know if this is going to turn. No, we have in our mind that even before we even crack the ingredients, this is going to be the most delicious Dutch apple pie I've ever had in my life. So you got to take that kind of aspect or that thought into a healing process as well. Is bring your mental game that you're doing all the right things and you will get through it.
I love that. That's fantastic. Dr. Mark, if somebody is thinking, okay, I might need some help and I am in that part of California, where can they find you?
Well, they can find me in Temecula, California. I have a very hard phone number to remember, 951-587 back. Go figure. So that's 2225. Um, Wine Country Chiropractic, because we are in Southern California wine country. We're not in the wineries, but we're in Temecula. Oh, website is winecountrychiro.com, WINECHIRO.com.
I love it. Fantastic. Thanks so much for joining us today, Dr. Mark.
Totally my pleasure. Thank you.
That sounds fantastic. We will ask you to join us on Substack as hopefully you guys are following along in our growing community on Substack. That's daretoagewellnow.substack.com. Would love to continue the conversation. Until next time, I hope you've been inspired today to dare to age well now.